about a rare inflammatory syndrome tied to the coronavirus in children. More than 330 cases have been reported, and at least 4 children have died. And now doctors say it could also affect young adults. CBS News senior medical correspondent Dr. Tara Narula joins us. Tara, good morning. To begin with, what are doctors learning about this new development?
Well, Anthony, by and large, we are still calling this syndrome a disease or a syndrome that affects children and teenagers. In fact, the case definition by the CDC requires that an individual be less than the age of 21. Now, that's not to say that we may not see sporadic cases or emerging cases in individuals that are over 21. That's really a cutoff that's a little bit arbitrary in the sense that we know that our biology and physiology doesn't change tremendously between 21, 23, and 24. So as we see some of these cases that fit the other clinical manifestations emerging in a little bit of an older population, the case definition may change. I think it just fits with what we're seeing with this virus, is that we're learning more and more each day. And really what this does is alert adult cardiologists like myself and internists to be aware if they see somebody with some of these symptoms and signs to be on high alert. You may want to refer them, and you may want to alert your health department.
Remind folks what the symptoms are, Tara.
So primary symptoms are going to be fever, moderate or high fever that lasts for several days, abdominal symptoms in children, so nausea, vomiting, diarrhea, a rash, bloodshot eyes, and then worsening symptoms might be things like chest pain or shortness of breath or lethargy or confusion. All of those should prompt parents to pick up the phone, call their pediatrician, and potentially take them to an emergency room if necessary, ideally one that has a pediatric intensive care unit.
All right, Tara. Dr. Tara Narula, thank you very much.